Welcome again to Techturks. Today I have with me Yemi Johnson. Yemi Johnson is one of the founders of FCC Health, formerly First Cardiology, and it has been around since 2008. Dr. J, welcome to Techturks, and thank you for coming on. So, you came back to Nigeria from the States to start First Cardiology, but now FCC Health. Clearly, you've expanded. So, what has the journey been like? Let's start off with that. 15 years in Nigeria.
Okay. In simple terms, it has been the most difficult thing I've ever tried to do, coming back home and trying to start a state-of-the-art cardiology in Nigeria. Been difficult but very fulfilling. And I'm happy I made the move to come back.
So, any experience? If I look at the state of, when you came back, what was the state of, healthcare, especially in that your field, and what is it like today, and what has contributed to any of the changes, positive or negative?
Okay, let me give you some background. My specialty is called interventional cardiology, which means we go into the heart without cutting you open. We go through the blood vessels and go in there and fix whatever has to be fixed. That specialty was not available in Nigeria when I came. That was one of the main reasons I came back home. And now in the US, I was in a group where there were 18 cardiologists in Charlotte, North Carolina. There were 18 of us, and there were 6 of us who did interventional cardiology. Of those 6, 3 were Nigerian. And I found it incredible that we're all here doing all these highly skilled specialties, but nothing going on back home. So I made a decision to come back home and see how we could start it in Nigeria.
So, COVID, pre-COVID. So let's talk about pre-COVID and after COVID. What has, in terms of awareness now, because I think one of the things that COVID has done is created more awareness about people's health, whether it's physical or mental. What was that experience for you?
The COVID experience, or the whole everything?
During,
during, and
now post.
Well, pre-COVID, there were a few of us like me who came back, diasporans they call us, who came back to try and improve the standards. And there's one clear thing: we have the skill, we have the people, but they're all mostly abroad because there's no infrastructure to work with back home. So slowly infrastructure started to develop. Then COVID came, everything came to a standstill. Worst part of my professional career ever. It was horrible. But COVID did a few things. It made Nigerians realize that we've got to fix our own healthcare. The guys who could afford to go abroad couldn't go abroad. They were stuck here. And then they found out that there's actually expertise in town, and it exposed them to some of us who were around, showing that we could do these things here. So heart attack, anything in cardiology can be done in Nigeria now, except maybe heart transplant. And that will be coming in due course. So the COVID stopped everything. The whole country, the whole world came to a standstill. Consumables, supply chain broke down, and we had to fend for ourselves. And it did improve the quality of healthcare in Nigeria. Yeah. It did, because we had to do things for ourselves. And then it showed that things were available. And that's where technology came in. And all the people looking after COVID, we had a COVID ICU, which is, the really sick people, all of them, most of the people on life support. And at that time, nobody knew really how to treat COVID. So all the ICUs around the world, we used to communicate, show our labs, show what's going on, and then we'll all put heads together and try and figure out what to do for the patient. And almost every ICU involved had something like CCTV, cameras focused on the patient and on the monitor, so we could all chip in and try and decide how to treat the patient. So COVID did bring that awareness. It was horrible treating those patients without knowing what to do, but we got through that. Post-COVID, I can say definitely, without any doubt, that healthcare in Nigeria has improved significantly. When I got back 2008, there was no interventional cardiology. There was no orthopedics at a high level like hip transplants, shoulder transplants. I mean, replacements. Those things didn't exist. They're now done in several places at a very high quality. Kidney transplant is also done at very high quality, and a lot of other things. So pretty much everything that is needed healthcare-wise is available. Most everything is available here. It's just not all in one center. So you've got to know where to go. But things have improved significantly since, when did I come? 2008. It's a major difference.
So doctor, I mean, like, I'm not an expert in this area, but I do know that information is very, very key in diagnosis and making the right decision, finding out. And one thing that I've experienced too is there's lots of machines today that are available that provide doctors with better insights as to what is happening to people, like your CT scans and all those. Before, I think when I was much younger, there's only X-ray machines that I actually knew. But today, there's beyond. I mean, there's a lot of improvement in that. Do we have that in Nigeria? And
oh yes, we do. Oh yes, we do. We have a lot of diagnostic capability now. CT scan, MRI, even PET scan, which is on the high end. We didn't have 2 years ago. Now there's at least one PET scan in Nigeria.
What is the PET scan?
Now, I wish you hadn't asked me that question. I don't know how to say it in simple English, but PET is positron emission. I even forgot what the T is. But it is.
Sounds expensive too.
They put radionuclide materials in you, and then they can see usually where the cancer is growing, where it has spread, and the best way to treat it. It's the highest end of radiological diagnostics in the world. So we have one now. Tomography is the T. We have one now in Lagos, and the others coming up. So it really transforms the management of cancer in Nigeria, and it also helps with the heart. So that's the highest end. We now have it. We didn't have it last year, 2 years ago, but now it's here. So almost every diagnostic equipment is available here. Almost all, not all, but we have made a lot of progress. So the diagnostics have improved significantly. So and with the diagnostics comes the treatment.
So FCC, I mean, like FCC started as
First cardiology. Strictly cardiology. Now we're multi-specialty.
So if you had a picture in your mind of where FCC will be in 5 years' time, and what will it be, and what will prevent you from getting there, or what is preventing you from getting there? And I'm sure those are the challenges that we face.
I can start with what will prevent us. Funds, money. That's the major obstacle. Because healthcare, the returns are not that big. It's not like going to the stock market where you can make 100% in 1 year. In healthcare, it doesn't just work that way.
Not in 1 year, but maybe in future years.
Yes, maybe, but it's a slow process.
Yeah.
And because of the fluctuation of the dollar with the naira, it makes things a bit complicated. But where I think we should be in 5 years, we're now multi-specialty. So our plan, the vision now is to go into the major specialties like orthopedics, nephrology, kidney transplant, ENT, neurosurgery. We want to get all that in place and then scale up to a bigger hospital and then have a franchise around the country where we'll be doing high-level work. And we're already beginning to move in that direction.
So, Doc, I mean, one of the reasons why I don't like to go into hospitals or clinics or any is every time I go there, it's like Groundhog Day. You know, you go in there, they ask you the same questions they asked you the last time you were there, and it's as if, you know, my records are not in one centralized place. And then secondly, as you get older, you know, they say like, once you're past 50, you have to go for regular checkup. So unless your doctor is proactive, you might let these things slide. And I know they say prevention is better than cure. I mean, like, are we going to see improvement in that? I think there's a term for it that you call it outside patient. I can't remember what the word is. I mean, like, just a whole onboarding process and just continuously managing patients.
Well, what you talked about asking the same question over again. It has to be done. That's to prevent mistakes. Because now we've moved over to electronic medical records. It's no longer handwritten, it's all electronic, where it's typed. So people like us who type 1 word per minute to disadvantage. But it's all electronic medical records.
But at least it's more legible now. You know, doctors are famed to.
Yes, my writing you can't read. I can come back and I can't read what I wrote a year later. But yes, so there's electronic medical records, but the biggest fear is making a mistake with the patient's name, because some people come, there can be 2 Yemi Johnsons, and you've got to be sure you're talking to the right one, and because medication for one could kill the other person. So it is important. It's just part of training. It doesn't matter how good the electronic medical records is, you've got to ask the person again, is your name Mr. Uzoma? Okay, check, is your date of birth this? So you confirm that that is all correct. So that's why they have to ask those questions again, unfortunately. Because even with AI, they're going to double check that that's the right person. Yeah. And AI is slowly coming into effect in our business.
That, I mean, that's interesting. Like I mean, like, what role does AI have? What role is AI play? What
like,
role is it playing?
Someone like me that has had a zillion years of experience, AI can put all that experience plus 100 other people's experience into an algorithm and come up with a better diagnosis than you can. All right, some days you're not as sharp, you haven't slept well, you didn't take coffee, you might miss a few things. AI will not miss those things. So I'm looking forward to AI really coming into, it will reduce errors for sure. It will improve diagnostics and it will improve treatment. Yeah. No doubt about it.
So in terms of procedures, have you ever done any procedure that you were not sure of, and how did technology help you to actually,
well, it? Yes.
Or the use of, basic technology or sophisticated technology, anyone?
Okay, well, let me give 2 examples. In what I do, interventional cardiology, where we put the catheters into your heart and then we take pictures of what we see, sometimes the treatment is not obvious to one person. So we have all these platforms now. You just put your angiograms on the platform, and then several other people from around the world. So you have second, third opinions on the spot. There are all people around the world, experts who are experts in different specialties that you're involved in, will now give their opinions and say, okay, no, we think you should do this, you shouldn't do this, you should do that. Then it helps you manage the patient like you were abroad yourself, because everybody's expertise is involved. The one interesting case we had was, I'm a cardiologist. I go into blood vessels, so I can get into any blood vessel in the body with a catheter. But my focus is the head and neck, that is where strokes come from, and the heart. And then we go into the legs, where you've seen people get amputated from vascular disease. That's what we try and prevent from going to the legs. So there was a patient who came in bleeding internally from the stomach. That's not my specialty. And there's only one guy available who came back, a young diasporan who came back. We call an interventional radiologist. He was away. That's his specialty. He go in there into the artery and puts coils into the blood vessel and stop the bleeding. He was away in Florida on a cruise, and patient came in. We had given like 20 units of blood already, and patient was pretty much not going to make it. So we called him. I said, look, I can get the catheter where you want me to get it, but I don't know what to do when I get there. So we put the thing on the screen, low-tech, WhatsApp, video, and we also had CCTV focused on the screen. And then he would look at where the bleeding, he told me where to go, and I put the catheter there, then I take a picture, say, yeah, that's the artery that's bleeding. Okay, you need to do this, you need to get this catheter. And he put me through the procedure. I'd never done one in my life, I'd never even watched one done. But through that, I don't know if it's low or high tech. He was tech.
Yes.
He was able to put me through, and the bleeding stopped, and the patient survived. So I felt quite good. I told him, we don't need you anymore. I can do this now. But yes, so those kind of things do help.
So you must get the movie right there. That's something out of a movie.
Yes, it felt very good.
Okay, a couple of more questions. Last week you sent out, I think you posted something about,
Heart attacks.
Heart attacks, and coming at a much younger age. Now, my question to you is that: is it because now we're more informed now, so like we're diagnosing better, or is it that people were dying of heart attacks at that age a long time ago, but you know how we just a hand of God, etc.
I think it's a combination of both. We have these international cardiac conferences, and I'm quite well known from Nigeria for giving them some insights as to what goes on here. When we go for these conferences, they tell you patients in India or in Germany will have chest pain. They know exactly what to do. They call 911 or 999, wherever they are. Ambulance comes, takes them to the hospital because it could be a heart attack. So they don't play with chest pain. So they ask me what happens in Nigeria. I say, well, first we reject it in Jesus' name. We might go to church, we might go to the mosque, but the last port of call is the hospital. After all those things I've tried, they go to Babalawo, it doesn't still work. Then they come into the hospital when all the complications have set in. For a heart attack or stroke, you've got to get into the hospital. For a stroke, within 4 hours. Heart attack, within 6 hours to reverse the damage. But if you come after that, you're going to be dealing with the complications. And that's what happens. So I sent her that message because that particular week, I treated quite a few heart attacks, and they were all relatively young, all under 50, including 2 women. So this thing is here, and the incidence is increasing, and we've got to be more aware. And please, take chest pain seriously. If you have chest pain, just come to the hospital. Make sure it's not something serious. It might not be serious, but make sure first. Don't reject it. And things like that.
Okay, final question. So, if there's one thing that you would advise leadership in Nigeria to do that would help, should I say, begin the process of providing more healthcare or more health conscious Nigeria, what would that be? I know
that's a political question.
Well, yes.
Yes, it is.
Everything, well, political. This is political season.
Well, let me say what's going on that's good. People are beginning to invest in healthcare, including the government. So there are a lot of hospitals and facilities coming up with the infrastructure, with the equipment. The biggest problem is the professional help. So the government's got to find a way of keeping our young talents from going abroad. And the reasons they go abroad are, one, not necessarily money, it's quality of life. Spending 4 hours on the road every day to work is just not sustainable for most people. So it's easier for them to go abroad.
And you cannot do remote working when you're a doctor.
It's difficult, but it's actually getting there. A lot of consultations can be done by remotely. Telemedicine, a lot. So we actually have a lot of consultants from different parts of the country helping us consult remotely. So that does work. But it's how to keep the professional staff here. You can't, and that's the one thing. How to improve quality of life of the healthcare professionals. But I don't think you can separate that from the rest of the country. Everybody's quality of life has to improve. So governance has simply got to improve.
Dr. Johnson, thank you very much for coming out to Techturks, and we'll continue the conversation offline.